Combining modern medicine with old-fashioned care. River's Edge Veterinary Hospital.
Hi, I'm Dr. Carla Cunningham with River's Edge Veterinary Hospital in Metropolis, Illinois. And today I'd like to talk a little bit about parvovirus. It doesn't affect people, it doesn't affect cats, but it can be very devastating to dogs, especially puppies. What does parvovirus do? I like to think of it as a lawnmower, and the lining of your intestinal tract or your dog's intestinal tract is filled with little fingers that increase the surface area of the intestines so that you absorb more water and nutrients. And what parvovirus does is acts like a lawnmower and cuts all those little fingers off. And so they feel nauseous, they're very, very sick, they have bloody diarrhea, they have lots and lots of vomiting, and again, no fun for anybody. We've had 3 cases of parvo in the hospital in the last 10 days, and it is no fun for anybody. Because it's so contagious, the dogs have to stay in a little isolation room away from everybody else so that we're not contaminating the rest of the hospital and getting other dogs sick. It's expensive to treat, the dogs are miserable, and it's just a much better disease to prevent than to treat. It's very easy to prevent this disease. It just takes vaccinations, and it takes a series of vaccinations. A lot of times people will bring in a sick dog and they say, it's had its shots. And I say, how many shots has it had? Well, it had one from the breeder. Well, that's not shots. That's 1 shot, and that's not enough. Parvovirus has to be vaccinated and boosted at least twice, and in young dogs, 3 and 4 times, just depending on their age. Unvaccinated puppies are 12.7 times more likely to get parvo than vaccinated dogs. That's a huge number. The other thing about parvo is it lives for 7 months in the environment, and it takes a solution of bleach water to kill it. Lysol's not going to kill it. Your typical household disinfectants aren't going to kill it. You got to use bleach water or industrial strength disinfectants that aren't available over the counter. Clinical signs of parvovirus are lethargy, or not, laying around, not having the energy that they normally have, anorexia, or not eating, and vomiting and diarrhea. Those are the 4 main things. I urge you, if you have a young puppy, don't hesitate to get it vaccinated. Don't wait. If they're sick, don't wait. Call. The sooner we see these puppies, the better.
Combining modern medicine with old-fashioned care. River's Edge Veterinary